Look at this rapidly multiplying cluster of dark organic shapes, aggressively consuming the bright background. We all harbor a quiet fear of cancer, and the numbers explain why. In India alone, 75,000 people die from it every single year. That accounts for roughly 20% of the entire global burden. This building is the headquarters of the World Health Organization. Their current projections present a grim reality. Over the next 5 to 10 years, that mortality rate is expected to double or even triple. The real tragedy behind those numbers is that many of these cases are highly treatable. The problem is timing. Often, the disease is not diagnosed until it reaches stage 3 or 4, long after the patient's body first tried to raise the alarm. Surviving this disease depends entirely on active observation. We have to translate our body's subtle early warnings and step in before a tiny microscopic glitch cascades into a system-wide failure. This ultrasound shows a fully formed fetus. It is the ultimate proof of healthy biological order. A single zygote divides into 2 cells, then 4, then 8, growing rhythmically and predictably over 9 months until a baby is born. We can see how this works on a microscopic level in this diagram. Notice how these 2 healthy, expanding cells touch at their borders and immediately stop growing. They establish a perfect, stable boundary to avoid harming each other. But watch what happens when a DNA mutation occurs. That biological boundary rule gets completely deleted. The affected cell ignores its neighbor, dividing wildly into a chaotic, jagged clump that simply crushes the healthy tissue. These rogue cells are relentlessly greedy. To fuel their rapid expansion, they violently siphon off oxygen and nutrients from your bloodstream. And because they originated from your own DNA, your confused immune system lets them pass right by without a fight. As this abnormal mass starves the healthy tissue around it and physically crowds the area, your body reacts. That localized theft and intense physical pressure is exactly what triggers the physical symptoms we eventually feel. To separate everyday aches from serious warnings, doctors rely on a specific diagnostic framework, the 3-week rule. If a symptom persists past 21 days, even after taking standard medication, it is no longer a typical infection. It's a potential biological override that requires clinical screening. Let's apply this to the upper body, starting with the mouth. Bleeding gums, painful mouth ulcers, or a nasal passage that inexplicably blocks up every night might seem minor. But if they hit the 3-week mark without improving, they act as specific alarms for oral cancer. The same logic applies to your lungs. A standard cough or a tight pressure in your chest is usually a passing bug. However, if you've finished a bottle of expectorant cough syrup and taken painkillers, yet 3 weeks later that cough refuses to yield, you need a different kind of evaluation. Lung tumors also broadcast secondary signals. If you find yourself struggling to pull in a full breath while simultaneously experiencing severe, unexplained pain radiating through your lower back, your body is waving a massive red flag. These lingering upper body symptoms are direct physical evidence of that chaotic cellular mass we saw earlier. The tumor is physically pushing against delicate nerves and blocking crucial airways over a sustained period of time. Looking at this photograph of a clinical examination, it serves as a reminder to transition from self-monitoring to professional help. For men over 40, prostate cancer often signals its arrival by disrupting bladder rhythm. Frequent trips to the bathroom, dribbling, an inability to fully empty, or the presence of blood require a doctor's immediate attention. Moving to the stomach, abdominal cancers create prolonged digestive chaos. Watch out for sudden, frequent bowel movements, chronic nausea, long-term constipation, or feeling completely full when you haven't even eaten a meal. For breast cancer, the warnings are highly tactile. You must actively monitor for hard, entirely painless lumps that anchor themselves in the tissue. Other crucial indicators include an inverted nipple or any abnormal discharge, whether watery or bloody. There is also an alarming threat to watch for, particularly in young children: brain cancer. The most prominent signals here are unrelenting, continuous headaches that ignore all painkillers, paired with sudden, unprovoked vomiting. Running through a list of heavy symptoms can feel intimidating, But treating these specific signs as a rigid 21-day checklist strips the ambiguity away. It gives you a decisive, strategic advantage over the timeline of the tumor's growth. It is crucial to note that many of these symptoms overlap with minor, easily curable illnesses. The purpose of the 3-week rule is to prompt a quick, professional screening to rule out cancer entirely, not to incite panic. You also have the power to stop that cellular override before it starts. The first step is eliminating primary biological triggers, specifically tobacco and smoking. These products act as direct catalysts, aggressively altering your healthy DNA codes into cancerous ones. As we pan across this vintage factory floor, we see the roots of another hazard: industrial food processing. Think about a batch of homemade tomato sauce. It naturally spoils in a day or two. A chemical-laden jarred sauce sits on a shelf for 8 months without decaying. The heavy preservatives required to freeze that decay place a toxic load on your cells. Watch this healthy, glowing white blood cell actively hunt down and engulf a dark, abnormal cell. You can arm your own immune system to perform exactly like this. Maintaining a healthy weight, keeping up with immunizations, and performing daily exercise naturally empowers your body to seek out and destroy microscopic threats. Even if you do everything right and feel entirely symptom-free, you need a final safety net. Commit to a comprehensive full-body screening every 1 to 2 years. The human body is a finely tuned, communicative machine. By respecting the 3-week rule and rejecting chemical triggers, we actively defend our cells and strip this disease of its greatest possible weapon, our own ignorance.